Welcome to the Newborn and Infant Trivia Game. These trivia questions are from the U.S. Nanny Association National Nanny Standards. These questions represent the skills and knowledge of certified newborn and infant care professionals. My name is Elizabeth Malson. I'm the Executive Director of the U.S. Nanny Association. It's my honor today to be your newborn care trivia host. As we get started, grab a pencil and pen as well as a sheet of paper so you can keep score. So what are our newborn and infant care categories? Well, they start with milestones, newborn and infant care, infant reflexes, safe sleep, newborn and infant health, and newborn and infant nutrition. Where should we get started? Let's start with infant reflexes. Infant reflexes for 200 points. What is an involuntary movement up to age 6 months when an infant wraps their fingers around one of yours? Grasp. Infant reflexes for 400 points. What reflex occurs when a baby appears to take a step or dance when they're held upright with his or her feet touching a solid surface? Stepping. Infant reflexes for 600 points. What reflex turns the baby's head to one side while the arm on that side stretches out and the other arm bends? Tonic neck reflex or fencing. Infant reflexes for 800 points. What is rooting? Rooting is when babies turn their heads as if searching for a food source. Infant reflexes for 1,000 points. What newborn reflex causes the baby to throw out its arms and legs when startled or scared? The Moro reflex. We have successfully completed infant reflexes. We have 5 more categories to go. Our next category is developmental milestones in the first year. Milestones for 200 points. At what age does stranger anxiety typically emerge in an infant? Six to 12 months. Milestones for 400 points. At what age does an infant typically begin to sit on their own? Six months. Milestones for 600 points. At what age does a baby typically begin to recognize faces and follow objects in their range of sight? (0 to 2 months). Milestones for 800 points. How can you support the development of individuality among twins and multiples? Avoid making comparisons, especially when it comes to developmental milestones. And to close out the category of milestones for 1,000 points, list 3 social-emotional milestones in the first year of a baby's life. First year social and emotional milestones include smiling, self-soothing, eye contact, and fear of strangers. Having completed infant reflexes and milestones, let's move on to our next category. Our next category focuses on health for newborns and infants in their first year. Health for 200 points. What is the most common cause of choking in babies and small children? Food. Health for 400 points. What is thrush? Thrush is a yeast infection in the mouth characterized by pain and white patches. Health for 600 points. What is the recommended amount of screen time for children under 18 months of age? None. Health for 800. What is the hive-like rash made up of red blotches with pale or yellowish bumps on the baby's skin? Arrhythmia toxicum. Health for 1,000 points. What do you do if a child has a febrile seizure? First, protect the child from injury, time the seizure, monitor the child and make sure the child is breathing and not choking, and then seek medical help. We're halfway through our game of newborn and infant care trivia. Our next category is newborn and infant care. Infant care for 200 points. What is it called when a healthy and appropriately developing infant cries intensely for long periods, sometimes hours at a time, for no understandable reason? Colic. Infant care for 400 points. At what age do most children start teething? Three months. Infant care for 600 points. What is the recommended minimum amount of time to read to babies between newborn and 12 months of age every day? At least 10 minutes a day. Infant care for 800 points. At what age should you begin baby sign language? at any age, but infants won't start making signs back until 7 to 10 months. Let's close out the infant care category for 1,000 points. What are the 5 S's for calming babies? Swaddle, side or stomach, shush, swing, and suck. Our last 2 categories are safe sleep and nutrition. Let's go to safe sleep. Safe sleep for 200 points. What is the recommended baby sleeping position? On their back. Safe sleep for 400 points. When putting an infant to sleep in a crib, what should be in the crib with the baby? Nothing. Infants sleep on a firm surface with a pacifier. No pillows, bumpers, toys, stuffed animals, or blankets. Safe sleep for 600 points. What sleep training method views bedtime as a time to connect by developing quiet, cozy nighttime rituals and quickly responding to a baby's request for food and comfort? The no tears sleeping approach. Safe sleep for 800 points. What sleep training method involves picking up the fussy baby and comforting the baby until they're calm and drowsy, and then returning the baby to their crib? The pick up, put down sleep training method. Safe sleep for 1,000 points. Behavior insomnia is most common in children aged 0 to 5 years. What are the 3 ways behavior insomnia presents itself? Sleep insomnia can show up as bedtime resistance, prolonged sleep onset, and nighttime awakenings. We've reached our final category. Nutrition during the first year of life. Nutrition for 200 points. What are the American Association of Pediatric, or AAP, recommendations regarding breastfeeding? The AAP recommends exclusive breastfeeding for about 6 months. Nutrition for 400 points. Who regulates commercial infant formula in the United States? The Food and Drug Administration, or FDA. Nutrition for 600 points. What is transitional breast milk? It's milk produced from day 5 to day 14. Nutrition for 800 points. What is the preferred way to transition from breast to bottle feeding? Gradually transition, starting with 1 feeding per day and increasing bottle feeds over time. Our final question, nutrition for 1,000 points. What is the role of the proteins and amino acids found in breast milk? They regulate gene expression. So, how did you score on newborn and infant care trivia? We covered first-year milestones, newborn and infant care, infant reflexes, safe sleep, health during the first year, and child nutrition.